For decades, vaccines have been a cornerstone of public health. These powerful tools have saved countless lives and protected generations from serious diseases. Measles, mumps, rubella, and polio. These were once common childhood illnesses that caused suffering and even death. Vaccines changed that. However, a troubling trend is emerging. Vaccination rates are declining in the United States, posing a significant threat to public health. When fewer children are vaccinated, the entire community is at risk, especially the most vulnerable among us. This decline is largely driven by a growing hesitancy among some parents to vaccinate their children. It is critical that we address this trend and ensure that all children have the opportunity to be protected from preventable diseases. One of the most concerning trends is the increasing number of parents seeking non-medical exemptions from school vaccination requirements. These exemptions, often based on religious or philosophical beliefs, allow parents to send their children to school without the required vaccinations. While these exemptions may seem like a personal choice, they have far-reaching consequences. As more parents opt out of vaccinating their children, it weakens what is known as herd immunity. This protection is especially crucial for those who cannot be vaccinated for medical reasons, such as infants or individuals with compromised immune systems. The rise in vaccine hesitancy and exemptions is closely linked to the spread of misinformation about vaccines. Despite overwhelming scientific evidence demonstrating the safety and efficacy of vaccines, myths and false claims continue to circulate, often amplified by social media. The rates of childhood vaccination are not uniform across the United States. Some states have high vaccination rates and strong laws limiting non-medical exemptions. Other states, however, have seen significant declines in vaccination rates fueled by lax exemption policies and the spread of anti-vaccine sentiment. For example, states like Mississippi and West Virginia have faced additional challenges in recent years. In contrast, states like California and New York have implemented stricter vaccination laws, including eliminating non-medical exemptions. These measures have been effective in increasing vaccination rates and protecting public health. These disparities highlight the need for targeted interventions and public health campaigns to address the root causes of vaccine hesitancy. The reasons behind declining vaccination rates are complex and multifaceted. While some parents may have genuine concerns about vaccine safety, many are influenced by misinformation and fear-mongering. Social media platforms and online forums have become breeding grounds for anti-vaccine groups spreading misleading claims. These groups often use emotional appeals and personal anecdotes to discredit scientific evidence. Additionally, the sheer volume of information available online can be overwhelming for parents, making it difficult to distinguish between credible sources and misinformation. Another factor is the growing distrust in government and healthcare institutions among some segments of the population. The consequences of declining vaccination rates are real and potentially devastating. As vaccination rates fall, the risk of outbreaks of preventable diseases increases. We've already seen this happen in recent years, with outbreaks of measles, mumps, and whooping cough in various parts of the United States. These outbreaks can lead to serious health complications, including pneumonia, encephalitis, and even death. Children who are too young to be vaccinated or who have weakened immune systems are particularly vulnerable. These children rely on herd immunity to protect them from preventable diseases. When herd immunity is compromised, they are at a significantly higher risk. The decline in vaccination rates is not just a personal health issue, it is a public health crisis. Addressing the decline in vaccination rates requires a multifaceted approach. Public health campaigns that provide clear, accurate information about the safety and efficacy of vaccines are essential. Healthcare providers play a crucial role in educating parents and addressing their concerns. Building trust in vaccines also means addressing the larger issue of trust in healthcare institutions and government. Additionally, social media platforms have a responsibility to combat misinformation and promote credible sources of information. By working together, we can create an environment where parents feel confident in their decision to vaccinate their children. Vaccination is not just a personal choice, it is a collective responsibility. When we vaccinate our children, we protect not only them but also those who are most vulnerable in our communities. By ensuring high vaccination rates, we can prevent outbreaks and safeguard public health. It is up to all of us, parents, healthcare providers, community leaders, and policymakers, to work together to combat misinformation and promote the importance of vaccines. Together we can safeguard our children and ensure a healthier, safer future for everyone.